I think Dr. Alka and Professor Mark also, both of them have covered beautifully the advantages and also other things. So I'll just share my views. I don't have any financial disclosures for this topic. Of course, we all know that the birth of Micropulse was initially for the retina laser treatments. So you can see that when you do the PRP, you can see how bad the eye looks, the retina, there are a lot of scars. But when you do with the Micropulse, almost there is no scars unless you do the fundus photo with the black and white pictures, you may be able to see, otherwise you can't see. The treatment paradigm has shifted for Micropulse to a wide range, probably as we have said earlier, even without any procedures, earlier procedures, we are doing the Micropulse now. So that's the advantage. So it goes to the entire spectrum of treating the glaucoma. So the advantage is you can see that you name a patient in glaucoma management, it is almost there in every given patient that we do the Micropulse. It's a large spectrum, almost covering the entire spectrum of glaucoma management. And this is a single laser machine with a one probe, and we can do the treatment for multiple patient types. So you can see the benefits of Micropulse transscleral laser therapy. It reduces the intraocular pressure by 30 to 45% with the success rate of between 60 to 80%. And how long it can stay, it is about 78 months, the IOP control has been shown. But the only thing is you may have to go for the retreatment of these patients. Some of them at least require a retreatment. So there is a possible reduction in the number of medications. We know that the number of medications reduction also plays a critical role, especially on the ocular surface. And looking at the safety profile, there are over 70 studies. They have shown that there is very low incidence of adverse events. And as I mentioned earlier, about 30 to 45% of IOP reduction is seen in 60 to 85% of the patients, with a good durability of more than greater than 12 months, and it is versatile. And it is very easy to use. Professor has already shown how easy to use that the new probe. This is the old probe, how we used to use it, like 5 continuous sweeps for about 16 seconds. And the whole procedure is done within 160 seconds. So that means it's kind of less than 2 minutes. So the procedure is over, the patient is more comfortable than much other like stent procedures. So it is a very good way to look at the treatment. Is that a retreatment possible in this laser? Yes, definitely. It is a first non-incisional laser, a non-invasive laser procedure with a high safety profile. What is that we are bothered about is the thicycle eyes. We have it in the regular diode laser. So there is a huge advantage when you do this. Even if you repeat, there's no need to worry about the thicycle problems, thysis eye problems. And when do we really do the retreatment? Probably about 6 to 8 weeks of the first treatment, then you can look at the retreatment. But later also, when the patient goes in for a failure, you can always do the retreatment procedures. These are some of the patients where we have done the laser procedure. So is that the TLT is advisable before the trabeculectomy or tube surgery? Yes, we all do that nowadays. It gives definitely good results. As Dr. Alka was mentioning, like before you do the trabeculectomy, where the IOPs are very high, like 40s and 50s, where you cannot do the trabeculectomy, you can do the cyclo procedure, TLT procedure, and once the patient is reaching about say 25 or 30, then you can comfortably do the trabeculectomy. What is that? The pitfalls, this is in our views, in a small setup, accumulating the patients, as we know, the probe may be used only for about say 45 minutes. And as the probe is slightly expensive as far as the Indian conditions are concerned, but this has to be worked against. There's a high variables. There are many variables to include in this. So I'm not going to talk about that in detail, but some people, you may feel that it is very costly, but then if you can accumulate the patients of about 4 or 5 patients, then the procedure is still viable. And the effectiveness is the one thing which we have to really look at it. In our scenario, Indian scenario, we have probably for 3 years, 2.5 years is the data that we have. And going in for the repeat procedures, we still do not know how many patients really requires a repeat procedure. We have to see that part of it. And regarding the visual acuity and the pupillary dilatation, some of us have come across this pupillary dilatation. That is mainly because of the probe misalignment at the limbal area. I believe the new probe, which has been well designed, that we will not have the pupillary dilatation and the visual acuity issues. That's what the company has come up with. Because the probe, we have had the pupillary dilatations. And there are some reports on the neurotropic corneal ulcers post-laser, but we haven't come across, till date, we haven't come across one. So I'll just share our results. We have started in the December month of 2018 till 2021. I have some results to show. So totally we have about 139 patients we have done. And of that, we have taken 115 eyes, but I have excluded the neovascular glaucoma from this and the pediatric eyes. So we have given the results of about 72 eyes. You can see this is the primary glaucoma of 51 numbers, and the remaining is the secondary glaucomas. And age group is close to 60 years, but there is a wide range that is varying between 20 to 86 years. But if you can see that there is majority of them are over 50 years, that is 73.6% is over the age of 50. So what are the previous procedures done in these eyes is about 31%, 32% of them had a combined surgery earlier. Then we had 26.4% of them had almost there was no other procedures done. These eyes are very bad eyes in the sense absolute glaucomas where we didn't go for any of the procedures because the patient wasn't willing for it. And about 23.6% of the eyes had a previous trabeculectomy. Looking at the anti-glaucoma medications and the intraocular pressure, you can see the table here. About 76.3% of the people were on between 3 and 4 medications. There is a majority of the group was that. And this is the follow-up. Of course, we had a little problem in the follow-up because the patients are coming from other states, and of course, few of them are from other countries. So we had some difficulty in 100% follow-up wasn't there. So looking at the intraocular pressure from the baseline was about 31 millimeters of mercury in our group of patients. So you can see the drop is 46% at the first visit. Then it goes on and up to, you can see that more than 2 years, there it is about 2.5 years. 2.5 years, we can say roughly about 34% is the IOP drop. It's almost consistently between 35 to 40% is what we can look at. But probably some of the studies like Professor Mark study and Dr. Anita study has seen that the baseline IOP was probably a little lesser, so the IOP drop was looking a little lesser. But as we all know that in glaucoma, once you have a higher IOP levels, then you may have a better IOP drop. That's a very well-known criteria. So this is very interesting to look at. When you look at the preoperative baseline intraocular pressures, as I mentioned, IOP was about 31. This chart shows how many people had IOP of less than 14 after the treatment. You can see that 36%, 40%, 28, 38, and you can see the 25%. These are significant IOP drop. That means below 14 intraocular pressures. And if you really look at all the other criteria, it's very interesting that if you have a 40%, 35% at least, then the progression of the glaucoma is almost, or I can say very less. I cannot say that it is going to be 0, but it is very, very less. And looking at the baseline medical number of medications versus the follow-up, as Professor was mentioning, we didn't have much of a drop in the number of medications like what Dr. Alka was showing. It is 2.93, and then probably at the end of 1 year, we had 2.36, probably about 0.6 number of medications drop, but otherwise it is almost the same. We haven't reduced the number of medications. And looking at the distribution of number of AGMs, so this is what I was just talking about earlier. This is an interesting slide. The visual acuity, we have given it in the LogMar. The initial, there is a baseline is 1.13, but there is a little bit of a drop in vision. But the problem in this chart is the follow-up of the patients were not the same. So some of them, at the end of 2 years, you can see there is a significant reduction in the visual acuity, but this is not the true. These patients were like more of an absolute glaucomas. They had all other problems like catoplasty, failed catoplasties, retinal other problems where they have developed during this period. So it is difficult for us to again say that how many people had stable visual acuity post laser, because the other problems we could not say what is good. So the same thing which we have shown it in this slide again. So it is very difficult for us to come to a conclusion how many had stable vision. Looking at the repeat procedures, we had 5 patients we have repeated out of the 72 eyes. The duration is between 2.5 months in some patients and varied to 13.3 months. That is more than a year. So before the intraocular, before the laser, the repeat laser, the IOPs were ranging between 20 to 48, and follow was, some patients had come only about 8 days after they haven't come back, and it has gone up to 24.5 months. So post after the TLT, the IOPs were like ranging between 11 to 30 millimeters of mercury. So this is to compare the other studies outcome of laser. We have seen that 30.6 to almost similar to our patients. The IOP drop has been close to 40% in this study. So just to conclude that the Iridex, the Micropulse P3 system is a very safe, non-destructive and a repeat procedure with a decent intraocular pressure reductions between 35 to 40%. Having said that, it has to be, the baseline has to be about 30 or 30 plus intraocular pressures. So thank you so much for your attention.